want to thank you all for joining us this afternoon. This seminar got registered the fastest of any we've had in at least a year. So that means there's a good interest. And you are a diverse bunch. There are CIOs, executives, physicians, lawyers. There are a wide variety of interests here, which I think really speaks to the topic of Health IT Contracts 101. What we're going to do today is not necessarily get into the weeds and try to make you all lawyers. That would be painful for you. But what we're going to try to do is give you a lay of the land. And if you're following on your hymnals, and you should all be seeing the slides, we're going to kind of put IT contracts, which are really different than almost any other contract out there. We're going to try to set that in some context, give you some different perspectives about things to consider and the dangers that are out there. We are going to get into some of the weeds because they're important. And then that's when the fun happens, and we decided to call the fun the vendor games. We're going to have the perspective of the providers, which are most of you are on the phone. There are some vendors on the phone, and the vendor part will be played by Kathleen, as she has 15 years experience representing vendors. And we're going to try to give you some strategies for negotiating. You can put questions as we do this. I will tell you that our concern is that we will not get to those questions, but we will follow up to the extent we can take one or two before everyone goes away. That's fine as well. Okay, so first I'm going to give two quick commercials. On October 20th, we're having the New York Metro ASC Symposium in Manhattan. It's a Friday. Feel free to register by going on the website if you have any connections with ASCs or outpatient surgeries. It's a jam-packed day. Okay, the next commercial is something that's very important for this particular presentation. Our group here, our Health IT Practice Group, was started about 25 years ago, and we thankfully have a large group of providers and some vendors who are giving us their contracts. And we have, quite frankly, learned by making mistakes over those years. And that's why you have that quote from Oscar Wilde: the hardest kind of teacher is experience, because it gives you the test first and the lesson afterward. We're going to try today to let you benefit from that experience by hopefully dispensing with some myths that are out there. But if you look at this slide, our group can really handle all aspects of IT contracting. Okay, so let's talk about the history of IT contracts. And I'm going to go back 25 years ago when I had less gray hair, and I was a beginning healthcare lawyer, and I got my first IT contract. I looked to the exhibits. None of them made any sense to me. They were very detailed and sometimes ambiguous. And I learned in law school that if you don't understand something, you can't sign it. So I realized that this was something very different. I then tried to negotiate it, and I heard things, this is a legal term, that these are contracts of adhesion, which is really what a bank contract is. You can't negotiate them. They are one-sided, and that's just the way it is. So being a curious fellow, I tried to figure out why that was, and I realized that it comes out of the experience of IBM. So we can blame everything. Hopefully there's nobody from IBM on this call, but we can really blame the culture of one-sidedness on IBM. In the 60s, they were really dominating. They had a monopoly. They were the only ones really producing software. And if you didn't want to agree to their terms, they didn't need to sell it to you, and you had no other place to go. And their original contracts, and interestingly, we've seen some, were cloned by all the other upstart companies that started in that space. And the culture of we tell you, customer, because we are all powerful vendor, what to do, still remains to today. Our job as lawyers and your job as clients is to try to push uh, back on that. And what we're going to do today is try to help you do that and make you realize that that culture need not continue to a large extent. Okay, so why are these contracts becoming ever important, and why are they becoming ever more difficult? So first of all, just to state the obvious, we know that providers are using software for every aspect that exists in their operations, whether it's billing, QA, robotics, whatever it is becoming a software and equipment that runs that software haven. And so the dependency, it's good for our group and the reason we keep growing it, but it means that these contracts are super important to focus on. The next kind of complexity is the regulatory requirements that kind of invade these contracts. So you could be looking at a billing contract, which we just did actually yesterday. It's actually billing software, and there was a major compliance issue right in the center of it. So we had to bring in our compliance group. You can have problems where you have HIPAA exposure. And as we know, OCR is fighting like crazy. We have a matter right now before OCR where our defense should be, well, we got this software and we didn't realize that it was vulnerable to a breach. That is not a defense that's going to work. So we're not quite sure what we're going to do. But there are even kickback concerns in there. Who makes the software? Is it physicians? And I just want to say one thing, which is important. I know that nobody out there would have this issue, but you might find that the issue comes up without you realizing. If you're a vendor, and there's a lot of not-for-profit people out there, so if you're approached by a vendor and they say, listen, come to our user conference in Puerto Rico, you can stay at the Ritz, you can have this, you can have that. When does it become educational and when does it start to become untoward? We're seeing more and more of that, and you need to be on guard for that because that sets up all kind of other issues. We're also seeing IT budgets that are growing, and I think that's really because of all the factors that I've mentioned. And what we're also finding, and this is something that, of course, none of our clients on the phone would ever do, but we get this a lot. This is just a simple piece of software. It's inexpensive. Please don't spend a lot of time. And we totally get that paradigm. And some of the things we're going to tell you today, and this is one of them, we don't really have a good solution to. But the problem is it's like a car. If your car engine has a filter that's worth, $5, if it malfunctions, it can shut down the entire engine. So we really need to worry about even the things which seem to be unimportant. Okay, so now let's go from the abstract to a little bit more. Things to consider. We get phone calls all the time. We have to have this software. Why? Because we can save $20,000 a year. It's so great. It does the exact same thing. Many, many times when we start to break it down, it's actually not apples to apples. And so we find out, and by the way, everything we're talking today are really things that are ripped from the headlines because they're things that we deal with all the time. Oh, okay, well, your old vendor was backing up your data. This particular vendor's not. So the $20,000 you saved actually could disappear, and this might be more expensive, okay? We also have quite often, yes, it's a cheap software, and then or cheaper than what you were using, and as we drill, it doesn't have those HIPAA security features that I was mentioning before. So it comes at a risk, and is it worth the cheaper price, okay? And then when we get into, and this is one of the reasons why everyone sometimes hates lawyers, is that when we get into the actual contract, we find out that there are issues which maybe during the sales process, which we're going to talk about, don't come out as quickly. So we have limitation of liabilities issues. If clinical records disappear, who's paying for those fines, right? If it's a contract that says we're only going to pay what you paid us, well, that's an economic issue as well as it's a legal issue, okay? And that also goes to the data breach. So the limitation of liabilities and the limits on warranties are something which can make a contract flow over into a product not being as good as you first came up with. Oh, first you first thought it was. Then you have plans for termination. So you have what is your plan B, right? What happens? And the plan Bs come in two flavors. One, what is the plan B if the product stops working in the middle? You have a downtime. You have, and we're going to talk about escalations. You're escalating it and nothing's happening. And we have seen major facilities brought to their knees. What's your workaround if it doesn't go right? Or if it doesn't perform as well as you thought it was going to be? That screen to screen went from 2 seconds to 20 seconds, and the doctors are freaking out. And then, and we put this in red, and I'm going to tell you that 98% of the times, and close your ears, vendors who are listening, we actually cut a deal. But there are some times, and maybe that 2% is extremely important, when you walk away because the risk is too great. This is not IBM, and they're often maybe not the best, but there's alternatives. And knowing when to do that is a very, very hard thing to call. But as of late, we are seeing it pop up as possibilities more than we thought. Intellectual property. Imagine buying a car, and I love car engines, and they bought a car and they tell you, well, the engine is made by somebody else, and that's subject to a whole different group of terms. You would look at the salesman with a funny eye. That's really what happens all the time in software negotiations. Oh, we want repping to that. It's made by Microsoft. It's made by this. So you have to look at those additional terms. So sometimes reviewing a contract means you're reviewing a contract within a contract. Okay, infringement. We're seeing more and more, I said Microsoft will stay with them, where they're coming and they're looking at your licenses and say, wait a second, you have too many people using the licenses, and they're coming to attack the end user. There's also, and sometimes the clients out there who wonder why we fight about having no limits on intellectual property warranties, they can go after the end user. Now, it doesn't always happen. They're likely to go after the one who stole it. But if you ever have a rainy day and you turn on your window wipers and you adjust it depending on the rain, you'll think of me, because that was stolen technology, and the person waited 10 years and then threatened to go after the end users, and all the American car companies paid millions and millions of dollars. So the infringement is super, super important. Okay, last slide before I turn it over to Terrence. And it leads to what I was saying. It leads from what I was saying. It's really important, especially with large systems, for you to have a working group within the hospital. Let's pick on hospitals for a second. And what I mean by that is, so your CIO will have one perspective, your finance group will have another. So finance will want to keep it cheap, will be concerned about payment in 60 days versus 90 days and interest. Your information technology will be concerned about getting the product in, getting it to work. Legal will be involved in trying to keep the risks down, and clinical will be worried about clinical. So when we give you, and the you might be, let's pick on the CIO, when we give you a comment letter or a markup, you need to go to your different constituents. They don't need to be on the phone with us at all times, but you need to go to them to get their input, because it really is a group thing as these things become more complicated. Just 5 quick concerns. Patient experience. How will this impact patients? Because at the end of the day, that's all that matters. And that patient experience could break out into many different things. What happens if the patient is hurt? It's a bad experience. Have you given away your right to seek indemnification from the vendor? They may not go after the vendor. They may only go after the hospitals. Interoperability. How does this little piece work with everything else? We love when it's a freestanding, having nothing to do with any other systems, but that's becoming more and more rare these days. Data retention, and Terrence is going to talk about that. DR, in terms of there being a problem, getting back your data, that's a huge issue. Return on investment, you're putting millions of dollars in. Can they fade it out? Will you make back the money you thought you were saving? And compliance with law. Compliance with law is super important. The laws are constantly changing. Before HIPAA was involved, no one ever would have thought any of those laws were going to happen. So it's really important that software, which you're going to keep using, that you have a warranty that allows those products to have to be updated to keep track with the law. And I'll end with this and turn it over to Terrence. One of the things that we learned early on, and this must be going back 17, 18 years, we had a client who purchased a major system, and then it was sunsetted after 3 years. And so the return on investment was gone. And when we said to the vendor, how are you doing this? They said, well, we can't make our old product compliant with law. It's too much of an upgrade. And we made that change. So these things are all extremely complicated and connected. And now I think we're ready to go into the weeds.
Okay. Thank you, Andrew. Good afternoon, everyone. Okay, I'm going to touch on basic issues that are issues that need to be considered in virtually every software contract, especially in healthcare IT. Okay, so I'm going to try to touch on all the big ones here. The first one is, what warranties do you need to push for? Intellectual property IP infringement is a basic provision that should be in every contract. If you ask for it and the vendor balks, then you should probably be concerned. It's like buying a car without a certificate of title. So intellectual property warranties are standard in the industry and should be expected. You'd be surprised, though, if you don't ask for it, sometimes it's not in there. When you do ask for it, 99.9% of the time, the vendor will give that warranty. So that's issue one. The next one to think about is a basic performance warranty. How do you know if a product is working? Sometimes I've been in situations where the vendor says it's working fine, and my client, a hospital or physician group, say, no, it's not. It doesn't have this functionality. I could have sworn it was in the demo. I need this. The way you work out that type of dispute is you have a performance warranty in the contract that states that the software will do what the documentation or the specifications state. If you don't have that, and a year into the contract or 6 months into the contract, you're unhappy with your performance, it's going to be very hard as a customer, as a healthcare provider, to argue that the vendor's in breach and you have certain remedies. So IP infringement and performance warranty should be in every contract. Uptime I threw in there. Again, that depends on whether or not it's a mission critical type product. You have to think about what happens if this product is down. What is my plan B? Would this affect revenue? Would this affect patient care? Those type of issues. Uptime, in my experience, I think people put too much time too much effort into uptime, and they fight over these often de minimis credits. What I would push for, depending on the product, of course, if it is mission critical and you're paying a lot of money, you can push for uptime credits. The one thing to be on the lookout for, do not allow the credits to be the exclusive remedy. I've had situations where a CIO says this product is down all the time. The doctors are furious with me. I have this 5% credit. that doesn't go over well with the CEO of a hospital. So make sure that when a vendor is giving you an uptime credit, they're not taking away more than they're giving you and tying your hands so that you're stuck with a credit and no other remedy. Okay. Data security, I'm just going to touch on, I think I touch on it later in a couple of slides. Data security is a blossoming and evolving field. We're all seeing these HIPAA breaches for $5 million, $6 million. It makes these IT contracts dicey. Sometimes you have a contract for $1,500. You're doing an interface, or you're doing a patient portal. It could be a few $1,000s in purchase price, but there could be thousands or tens of thousands or even hundreds of thousands of patient records with the potential liability in the millions. So data security, the provisions you have to be aware. We're going to talk about it later, but just asking for compliance with the HIPAA technical security provisions, technical security features is no longer enough. We used to argue that 10 years ago. We thought that provided some basic protection, and it does. It will give you audit trail. It will give you log off. It will give you unique user ID, but it doesn't have a lot of basics. For example, encryption. Encryption is becoming the de facto standard for a lot of major databases with PHI. Yet that is not required by HIPAA. So just the one thing to be aware of is don't just add a standard provision saying this product will comply with the HIPAA technical security features. You have to really, if you're a hospital or a large physician group, or if you have a consultant, IT consultant, a virtual CTO, somebody, find out what do you really need based on the scope of PHI involved. For example, do you need encryption? Do you need SOC 2? Do you need SOC 2 data center? So that's something that, again, as Andrew pointed out earlier, work with, it's a team effort. Just to do it solo, often we don't see all the different various aspects and risks involved. So data security is definitely a hot button issue nowadays. Compliance with law is another basic warranty. You can't use a product if it doesn't comply with law. So for example, if you have an FDA medical device, it's very standard for there to be an FDA compliance with law warranty. If you have a website, this is a recent one, we had a client who had a website and they were collecting information and sending out email blasts, and then someone complained saying it violated the anti-spam rule. So that's another thing just to think out. Apparently, if you don't affirmatively consent to it and have a click box, it's not necessarily complying with the federal CAN-SPAM Act. So there are those type of issues to be aware of. Meaningful use, I think everyone's aware of that. You want to have meaningful use compliance for any EHR or any of the core elements that could lead to either the loss of dollars and grants or also penalties in terms of reduced Medicare and Medicaid payments. Federal reporting. There are a bunch of compliance with law provisions. Compliance with law provisions is a standard provision we typically insist on. The other thing we'd like to clarify in these provisions is we'd like to state that if there is a change in law, as long as we're purchasing support or it's in the subscription term, the vendor will make the changes necessary at no additional cost. And sometimes you have to negotiate that. Sometimes vendors will say, we'll do that for federal law, but we won't do that for state law. But those are things you just have to be aware of so that there are not too many hidden costs. Okay. The next issue, one of a lawyer's favorite issues, is limitation of liability. Every contract that I've seen in the past few years has a liability cap. Here are some of just key things to be aware of. Ask for it to be mutual. If it's good for the vendor, it should be good for the customer. Often ask for multipliers. The typical contract will say, in no event will the vendor be liable for more than 12 months worth of fees. That's the standard. You can argue 5 times, 10 times. You can ask for it in no event less than $1 million. It all depends on your negotiating leverage. But I think sometimes the more important issue, especially for the smaller contracts, rather than fighting over the liability cap, you try to negotiate carve-outs or exclusions. So, for example, the really big items are IP infringement, PHI breaches. Those could be millions of dollars. So you try to carve those type of liabilities out of the liability cap. There are other things depending on the product, of course. Personal injury, if it's software that's used for the direct diagnosis or patient care, that should be carved out. Third-party claims, all sorts of things. But at least in today's day and age, IP infringement and PHI liability you should try to carve that out. Sometimes you're not going to get unlimited liability, but we've even had some success in negotiating higher liability caps for breaches of PHI. So those are things to be aware of. Another issue, which is a little bit troubling, is whether damages are considered direct or consequential. There was a recent case called Silver Pop, where the circuit court, federal circuit court, held that even though there was a carve out from the liability cap for direct damages caused by breaches of confidentiality, the court held that the vendor who allowed a data breach was not liable at all, because data breaches are consequential damages because they're not easily foreseeable. I mean, I think it's a bad case, but I don't have authority of law, so that is the federal circuit court's recent opinion. So you really have to be careful. If you negotiate these provisions, you don't just focus on the direct damages, you have to focus on the consequential incidental. It's very tricky on how a judge or jury would make that determination. Okay. Other issues to consider: scope of license. Licenses can, software can be licensed by site, enterprise-wide. It can be by bed, number of users, and then you have to clarify whether it's concurrent users or named users. It can be licensed by revenue. There's a whole host of licensing metrics that you have to be aware of when you're negotiating a contract. There are law firms and trade associations, for example, SIIA, which has been sending complaint letters to a bunch of our clients lately, saying they're exceeding their SQL license or they're exceeding their Adobe license. And they don't just ask for missing license fees, they ask for penalties and legal fees. So be aware of that. You should always have an inventory list of what type of software you have, and to make sure you keep copies of your software licenses. They are starting to enforce this more and more. I think I've dealt with or been involved with 3 or 4 Microsoft audits in the past, in this 2017. Okay, other issues in scope of license. If the license is term limited, you need to make sure, you have to kind of, when you're an IT lawyer, you have to also kind of be, or when you're involving yourself in an IT contract, you have to be a divorce lawyer in some ways and plan what happens if this terminates. How do I get out of this without it being too expensive or difficult? So you might not allow the vendor to have the right to terminate without cause, even if you as the customer want it. There are other issues to think about. Think about transition rights. In today's software environment, a lot of software is hosted, and so it's more critical than ever that there be transition rights, and that the customer just is not cut off from key software functionalities. There should be a right for post-termination transition services, or some type of process, so that there's not a disruption to operations. And if you ask for it, the vendor will typically give you this. They'll want this, but you have to ask about it up front. If you don't ask about it, I've had some situations where the new issue is data being held hostage upon termination. If there's a unfriendly parting of ways, I've seen it where the vendor will not return the data or will not send it in a formatted way without gouging the customer one last time. So you really want to clarify and think ahead. Even when you're entering into the contract, you want to think ahead of how will you get out of this, and how will you transition to a replacement vendor. One of the bigger issues that I see in every contract, this is probably the number one issue, is know what you're getting. When I look at contracts, especially when I first get them, I often have to call the client to say, what are we getting? What is the deliverable? What is the service? What is the scope of service? I don't really have to call them to say, what is the fee? What is the price? What are the payment terms? Those are always very clear. But knowing what you're getting, clarifying the deliverables is key. So if you read a scope of work or a service description and you don't know what it really means, then that's not a good sign. You have to push back to the vendor and have them explain it and clarify it. because that's really how you hold them to the fire. You'll these fuzzy deliverables are not good to work with. It oftentimes, if you address it now, you'll avoid problems down the road. Okay. Another thing is make sure you have clear metrics when you're trying to figure out what you're getting. If, for example, you're doing an outsourcing or staffing contract, think about how would I know if I'm getting the bang for my buck? So, for example, you would list the number of FTEs and the experience and those type of things. But focusing on clear deliverables, concrete deliverables, is key to avoiding problems down the road. I think I kind of jumped ship. So scope of work, this is what I was talking about in terms of clear deliverables. One other aspect to consider is tying payments to milestone. Don't pay anything, don't pay that much upfront. That old adage of possession is 9/10 the law still holds true. So when a vendor says, I want 100% on signing, you should counter that. You should think about when will I feel comfortable that I've received value for my dollars, and you should tie payment to those type of milestones. So even when vendors push for it, I want payment in 30 days or 60 days or 90 days, we typically resist those provisions because we want to tie payments to actual accomplishments. So it's becoming standard now to ask for anything that involves a complicated implementation, to tie payments to install or a go live date or acceptance, even a post go live acceptance, which allows the customer to test the software and to make sure it's really working, not just go live when the vendor flips the switch and says it's ready to go. So those are important issues. And at first the vendor will be resistant to that, but I find most of the time the vendor does agree to implementation milestones. Okay, support and maintenance. So in terms of I'm trying to avoid hitting costs here. So if you do sign a contract, just realize the software is only going to be useful for as long as it's supported. If they sunset it, or if they give you a support quote after the 1-year warranty expires, be prepared for that. I have seen vendors that charge 26% of the license fees when you ask for a support quote a year after the contract signing. And if you ask for it up front, they charge 20%. I mean, it really does save money if you think about what are the ongoing costs to maintain this software. And also you should ask for a support description. I'm amazed at how many times clients sign contracts and they don't know what the support terms are until after the fact. If you ask a vendor for what their for a description of the support terms, they usually have a document. They send it to you, and then you can see, oh, it's 24/7 or it's 9 to 5. It's a 2-hour response. I mean, but you have to ask for those provisions. If you don't ask for them, vendors typically don't offer them up front. Okay, I'm going to move a little faster here. Investment protection. Okay, oftentimes look for a cap on increases, on annual increases. If you enter into a license agreement and you do not have a cap, a lot of vendors are doing 5% or CPI plus 5%. Try to figure out what those costs are now and try to lock it down for your own budget purposes. If you ask for a vendor for a CPI increase or a 2% increase, 3% increase, you can really save money over the long run. One tool we use with our clients is we usually have a discussion about what is the total cost of ownership. There are often hidden costs. Are the fees time and materials? Are these estimated fees? Are these fixed fees? What are the internal resources? Will we need third-party software or hardware? These are things to consider upfront and ask the vendor to spell it out. You'd be amazed at how many times there are hidden costs, and the third-party fees are just marked saying you have to purchase all these third-party products yourself, and that was not made clear to the client. Okay, next issue. Data retention. I touched on this earlier. Some basic provisions. Make sure every contract clearly, expressly states data is owned by the provider. That should be a non-issue. Every contract should deal with that and state that. In addition, you should limit or you should ask the vendor how they plan on using your data. It's becoming more and more common for vendors to put in a line saying, to the extent the data is de-identified by us, we can do with it whatever law permits, which is basically anything. And some vendors are even selling our clients de-identified data. So those are the type of things to ask for. We typically limit the use of de-identified data. Unfortunately, we've had a few vendors who have not de-identified data properly, which led to major liabilities for our clients. So those are things you really want to control and think about. I think I already talked about return of data. Make sure that the contract expressly requires the vendor to return data, especially in a hosting environment. Okay. I think I'm running a bit late.
Yeah, you
Okay, the hosting dilemma. So we talked about most of these data security issues. Just two things that I just like to point out. Disaster preparedness. You have to ask your vendor if they have a DR plan, a data backup plan. They often, some vendors don't. Some vendors do, they'll provide you a simple description, a high-level description. Don't be afraid to ask more questions about that. Don't be afraid to ask for a DR testing plan to make sure the DR plan is actually working. I think a lot of clients who use Nuance for their transcription services just experienced an outage of transcription services for 2 weeks because while Nuance had a DR plan, the WannaCry virus wasn't prepared for the WannaCry virus, which jumped from the live site to the replicated site. So the DR plan, all that planning, didn't play out. But those are things you have to consider, especially for mission critical tools. I think let's run into that.
Okay, all right. So now we've gone from the theoretic to the detailed, and now we're going to have some fun. Not that wasn't fun. So we're going to introduce a new player who is Kathleen Benitez. She comes to us after having spent 15 years working for some vendors before she came over to the dark side and worked for the provider community, as well as some vendors. So we're going to have her play the vendors. So Kathleen, I'm going to start this off by turning to you first and ask the question, why, given that IBM has lost its monopoly, and again, you're channeling your inner vendor, why are so many ID contracts still so one-sided?
Thank you, Andrew. I want to first just say thank you for having me here and also welcome to everybody. I think from a certain respect, vendors get a little bit of a bad rap here. There are a lot of clients who will sign the contract as is. And of course, we as a vendor have to answer to our shareholders, to our investors, to potentially our insurers, and even our other clients. So we don't want to overpromise. We want to make sure that we've covered all of our bases and protected our rights. And then we're generally open to negotiation when asked.
Okay, so here's the question we get a lot from clients. You and Terrence, well, I'll play Terrence because he's going to be the provider side. Terrence gives a huge markup, and you're now on the vendor side. Do you ever get that markup and just tell your client, look, let's get out of here. This is never going to work out?
Well, there's always a walk away point. I think that's true on either side. But as long as the markup is reasonable, we're going to probably find some wiggle room. We're going to meet in the middle. And we want to make sure that we're protecting both parties' interests. So it's going to depend on the vendor, it's going to depend on the client and the specific circumstances of the deal. Obviously, if we've already given in a lot on price, for example, we might be less flexible with some of the terms in the contract, like termination rights, because they're going to implicate one another.
And does it also depend on the size of the client?
Oh, absolutely. Absolutely. Because again, that's going to have an impact on where our flexibility is in terms of liabilities.
So to the physicians on the phone, they're not going to have as much flexibility as the hospital systems.
Depends on the type of vendor. If I'm a vendor who's working primarily with small physician practices, then that's the environment I work in, and therefore I'm going to be more open to work with those physicians and to make sure that my product is going to meet their needs and my contract terms are going to meet their needs as well.
Okay. So Terrence, here's another question we get from clients a lot. You've just finished, let's say McKesson. You just finished a big McKesson contract for Hospital A. Can't you just, and then you get from Hospital B, the unnegotiated McKesson contract, and I'm just using McKesson as an example. Can you just call up McKesson and say, hey, just give us the first contract, which would save them time and money for the client?
Sure, we do that all the time. Most of the time I find the vendors are willing to do that and to duplicate terms. I usually do that, offline without the customer on the phone, but I just do lawyer to lawyer. And that usually works, especially if it's similar in scope, the pricing and the services are similar. But yeah, we save time for clients all the time doing that. Sometimes the vendor will just say no, and maybe they like spending time with me, and we'll run through the same negotiations as we've done before. But by and large, most lawyers are busy and would love to save time by duplicating previously negotiated terms.
Okay. So your group has a list of contracts that have been negotiated so that you can call them up and say, hey, we just did this on 6 months ago?
Oh yeah, we have thousands of clients, thousands of vendors that we've negotiated. We have contract forms for. I mean, you see a lot of the big guys again. You'll see Nuance, you'll see Epic, you'll see McKesson. You see a lot of eClinical Works. Some of these contracts we've negotiated dozens of times. But yeah, we do keep a master list, and it's kind of a cheat sheet. It saves time for us and saves money for our clients.
Okay, so here's the question. We want your honest answer. Do you sometimes give the markup in, and it's totally rejected?
Sure, it happens rarely, but I have to say yes. Thankfully I'm used to rejection, so it goes. I'm used to it. I can handle it. But most of the time, I mean, 90% of the time or more, the vendor comes back and is willing to negotiate. A few times, the cases where I sometimes am outright rejected 100% is the case where you have a software vendor that is selling services for a small dollar amount and it involves large amounts of EPHI. In those cases, those are the trickiest ones. Sometimes the vendor just won't budge. They say it's not worth the risk reward. We're not willing to change, and they'll reject everything.
Okay, so Kathleen, let's say we have Terrence is asking a lot. You're channeling your inner vendor now. What will you do to try to put some distance or create some conflict between Terrence and his client?
Well, I'm likely to point out that it's a very cumbersome markup that he's handed me, and it seems like a lot of changes. And I'd probably ask for us to reduce the issues down to a simpler set, so that we can really focus on the high priority items and try to make some headway. Because if it's not cost effective for me to negotiate every word in the contract, I may be more inclined to walk away from the client.
Well, not that you would ever do this, but would you sometimes send the salesperson to call up the client and say, you got to get your...
Oh, absolutely. I think that's something that I've seen on the vendor side, that, the salespeople have to maintain a relationship with the client. So, as an attorney, I'm going to say, hey, it seems pretty heavy. Do you guys have a meeting of the minds on this? Is there already some agreement as to what the term is going to be and what some of the basic tenets of the contract are going to be, so that we can try to speed up this process?
Okay. All right, Terrence, unfair question. Let's go back over the last 2 years. It's an unfair because I'm asking you for averages and you've never calculated. On a scale of 1 to 10, 1 being a terrible contract, you get a 1. On average, how much can the client expect it to improve, where 10 is ideal?
That's a tough question. All contracts depend on the price involved, the risk exposure, what market share the vendor has. By and large, I think anyone who's negotiated with Epic or Nuance knows they're tougher than other clients. McKesson Allscripts are much more willing to haggle. So what would I get? I mean, The smaller, I'll tell you one thing, the smaller vendors often give in a lot more than the larger vendors. Now, whether that is really offering you more protection, if they don't have any assets and they're promising you the world, then those contracts aren't really worth much. So in those cases, then we push for cyber liability insurance or very good insurance provisions. But if I had to give you a number, I mean, a one, look, if it's a one, that's a horrible one-sided contract. Maybe I get up to 6 or 7, but again, it's variable.
Okay. All right. Question to both of you, but ladies first, so I'll start with Kathleen. Can you pick an area where you rarely get improvement as a vendor, where you're rarely going to really have flexibility?
Yeah, I mean, from a vendor perspective, I think obviously we're going to be looking to the liabilities that we have to make sure that we can sustain our business. So one of the top areas there is going to be limitation of liability. I know we spoke earlier about limitation of liability and often using multipliers. That's kind of one way that vendors will go. We'll say the last 12 months or the last 24 months of fees or something to that effect. But the reality is these days, from a vendor perspective, you have to realize that there's no longer this, in many cases, big chunk of upfront money. It's a lot of a SaaS model or a service model where we make our money over a 3 or 4 year term. So, we have to consider a return on investment as well. If we have a high liability cap and we're only a year into the contract and something goes wrong, then, not only are we out all of the potential monies that we were planning to make in order to get our return on investment, but we're also now subject to this high liability cap, which could put us out of business.
Okay, great. So now, Terrence, I'm going to ask you the same question, but you can't pick the same answer as Kathleen. What's an area where you find you rarely get improvement?
Okay, that's a tough one if I can't give the same answer because I find typically limitation of liability is the last issue resolved in any contract. You start it off, you mark it up. That's the provision that goes back and forth 4 or 5 times. In the old days, we used to get unlimited liability for PHI breaches. I'm not getting that all the time now. 10 years ago, we were getting that 95% of the time. Now we're getting it, maybe half the time. But I'll tell you the flip side. I know what we typically get easily. You'll get an IP infringement warranty. You'll get a governing law. You'll get that 95% of the time if you ask for it. You'll get performance warranties. It's very hard for a vendor to say, no, I'm not going to stand behind my product and say it's going to work. I mean, some of those things are easy. It's easy, low-hanging fruit. You just have to ask for it. But I wanted to think of something different, but I think ultimately I agree with Kathleen. The limitation of liability is becoming the most contentious issue.
Okay. Kathleen, put on your vendor hat again. We seem to have this a lot where a CIO, for example, will give us a contract and he'll believe that it should say A, but then you look at the contract and either it doesn't say A or it's not really saying A. Why does that happen? Like what's going on there?
Well, I mean, there can be misunderstandings between salespeople and the attorneys, or it could simply be that the salesperson is maybe, zealously representing the product, and in that case, offering functionality that may not be entirely available yet, or may not be contractually, they may not be contractually obligated to provide. Sometimes people call this vaporware, but it happens, but you have to really hold the feet to the fire. So if you're looking at a scope of work, as Terrence mentioned earlier, you want to make sure that scope of work details what the deliverables are, what the product is going to actually give you. And you have to also realize that it's not necessarily that the vendor has poor intentions. They just, they have pride in their products. They have a desire to please the client. And oftentimes they have, they're aware of projects that are going on and may not come to fruition. So they're not in a contract yet, but the salesperson wants to please all their clients and they want to make sure that they can provide a good offering in order to do so.
Okay. Here's my favorite one because it's always on a Friday and it's the reason why my ulcer is as big as it is. Terrence, client comes to you and says, you got to review this in 48 hours. We got to sign it on Monday. Of course, it's Friday, on a beautiful sunny Friday, and it's 4 o'clock, because the quarter's going to end, and they're giving us a discount. You got to have it. First of all, am I right that happens a lot? And two, how do you deal with that?
Well, I've heard of that happening to other lawyers. I don't think our clients would ever do that.
Never.
But I usually just like to stay here till midnight at the end of the quarter because it's a great place to work at,
Yes.
and the kids are very noisy. But yeah, no, that happens all the time. And that's the sales rep putting the pressure on to close the deal and get their commission. Happens all the time. Every end of the quarter, every end of the year is always a crunch time. Usually the vendor is bluffing. The price will not be withdrawn. I would say overwhelming majority. I think maybe I've seen 2 or 3 times where the vendor actually carried through on that threat. And that's out of thousands and thousands of contracts where the vendor said, you didn't sign by the 30th, June 30th. It's July 2nd. And now it's $100,000 more. Usually that doesn't go over very well with customers, with healthcare providers. And they had that number in their head, they budgeted for it, and usually you go past that deadline, as long as it's within a week or two, you're still going to keep that pricing.
But what do you say to the CIO? Let's say out of 100 happens once. What does the CIO say to his finance manager who says, you just cost me $100,000?
Well, the 1 or 2 times where I've seen it actually happen, the hospital went to another vendor. When the vendor tried to change the fee significantly, they went back to the budget because this dollar amount had already been approved for budget purposes, and it changed significantly. And in those 2 cases, one, they went to another vendor. The other one, I think the vendor actually backed down after the CFO got involved, because it was a very sour, it was a bad way to start a relationship. Let's say that.
And I would also say that I think sometimes when you rush, you make mistakes. We've seen that, right? Because people are human. Okay, we're going to do some rapid fire stuff now. All right. Terrence, GPOs, everyone's using them. Is it something that can save all of this nonsense? Stop us from having to argue?
Generally, for IT contracts, the GPO terms are not enough. If you're buying diapers, you're buying some low-risk item, sure, GPO terms are good because they focus on pricing, payment terms, etc. But when you're dealing with IT contracts, software liability, critical functions, usually the GPO has focused again on payment terms and pricing. The GPO is paid 3% of the total price, so that's what they focus on. They do not typically negotiate the legal liabilities, the special warranties. They don't have that expertise, and it's not really their incentive. But most of the time, the GPO vendors will say, "Go at it, client. Go negotiate with the vendor directly and negotiate better substantive terms." The vendors may say sometimes, "No, you can't do this. This is a GPO contract." But you should really check with the GPO. Don't listen to the vendor. The vendor doesn't want to negotiate the issues. Most of the time, the GPO will not care.
Okay. All right, Kathleen, to you. I'm a CIO, or together with the finance person. Why do I want to do an RFP? It's a major project. It's having an RFP is, I got to write it. Maybe I hire a consultant to do it. I got to look at what I get back. I know what I want. Why do I need to do an RFP?
Well, for one thing, it's going to get away from that vaporware that we talked about earlier, right? You're going to get more concrete deliverables from a client. From the vendor rather. You're going to have an idea of what each vendor is going to provide for you, so you can comparison shop. And that response can, in many cases, be incorporated into the contract. So you don't necessarily even need a full RFP is another option, right? You could get multiple quotes from multiple vendors and also get some of that negotiation position. But it does allow you to compare apples to apples. So, the price is only one piece. And we talk about this all the time with clients. You can't just look at the price of something. You've got to look at the risks. You've got to look at the deliverables and all of these things that we've been talking about today. And the RFP process, or even, like I said, just getting those multiple quotes and comparing the terms of the SOW, the contract itself, can really help you to have a stronger negotiating position.
And I'd just like to add one comment to the vaporware issue, because I have seen that happen again and again. I asked, the question you have to ask yourself is, would I buy this product if this future version never comes out? If it's critical to making the purchase, you should just hold off. Vendors will not promise something that's not GA, that's not generally available, but just realize you cannot rely on that. And I've seen it again and again where a hospital bought a system, bought an MRI, they thought the upgrade was going to speed up performance. It never comes out, and you really have no contractual remedy in that case.
Okay, so hang in there, guys. We got 3 more minutes. We're not going to get to the slides, but I see one of the questions, which was a good question, is how do you get copies of the slides? So our emails are on the back. Email any of us, we will send you a copy. Okay, Terrence, these annoying lawyers. When should a CIO get you involved?
The general rule is the earlier the better. If the price has already been figured out and the vendor has been selected and the vendor knows that, and typically the business folk and the CIOs work on the scope and they work on the price. Once that happens, we have much less leverage. So sometimes even at the vendor selection stage, you can ask us, if it's a significant enough contract, ask us to look at those terms, and we'll point out some of those terms should be discussed and evaluated when you choose your vendor.
Okay. Well, related to that, do you ever play good cop, bad cop? Like, is that a role that, I mean, you're a bad guy.
I mean, anyway, so it's very easy for me to play bad cop. But generally, look, once the contract is signed, I walk away. Typically, it's the hospital or it's the physician group that has to work with the vendor and maintain an ongoing relationship. So usually I'm the bad cop, the customer is the good cop, and that's one of the services that we can add.
Okay, last question, Kathleen. You're going to end the day. For all the clients and non-clients that are on the phone, what is the one thing, you can only give me one because there's no more time, that they can do to help themselves as they get inundated with all of these IT contracts?
Working out standard provisions is very helpful. So you have a standard position. So you know when you're coming into it, when you come to the attorney, you can save attorney costs, you can save time, and really streamline the negotiations both before and after you even get involved with the contract. If you know, for example, that you have to have a right to terminate without cause in every contract, that there's no way you're going to get it past your executives without that, then you should maybe pull that into your pricing negotiation and realize that the vendor in the 11th hour is not going to be too thrilled if you start saying, yeah, we've negotiated this price. Oh, but by the way, we can't commit to 5 years. We have to do only a 30-day termination clause and everything.
So work out also arbitration, what your position is, and all these issues.
Absolutely. All the top hot button issues that may be important to your organization.
Okay, everybody, thank you very much for spending this hour with us. We tried something different, and hopefully you got something out of it. Thank you, and feel free to call us with all your needs. Take care.